Aqua-certified therapist Christine Galata recently held a live demonstration out at the LifeQuest Aquatic Center. She was happy to educate attendees on the benefits of aquatherapy and to demonstrate many techniques to help improve range of motion, build strength, improve circulation, and increase balance. Here's a recap of her demonstration.
Thank you for coming out, and thank you to some of our live models for showing some of the exercises. They will be demoing some different things while we're going through the presentation, and we will specify some of the different exercises as well. I wanted to make sure that if you have not been to the therapy department, that you had an opportunity to see the indoor pool that we have over there. It's kept between 90 and 92 degrees. It has 2 underwater treadmills. So we see people that are inpatients and outpatients. If you're in the pavilion for inpatient rehab, we're able to accommodate pool therapy if it's appropriate for you, and we also do it on an outpatient basis. Aquatic exercise is for almost everyone, almost any diagnosis or disease process. You do not need to be a swimmer to be in the water. Most of the pools that we use have different depths, so as long as you're able to put your feet on the ground, we'll be in there with you. The reason that aquatic therapy is beneficial is the principles of the water. You have buoyancy, so that brings your body weight up, making you feel lighter, which is great on those arthritic joints. There's also the viscosity of water, which is the thickness of the water. So the rate that you move your limbs, your legs or arms, will give resistance. If you move them very fast in the water, you'll have a lot of resistance, which is great for strengthening. If you're weaker and you move a little slower, you still get some benefit of strengthening. You're able to move at what you tolerate. And then there's also hydrostatic pressure. So that's where the water is putting pressure on your entire body, from your feet all the way up to whatever level you're submerged in. Great for controlling swelling. Treatment may include increasing range of motion of joints. So being able to freely move your ankles, your knees, your hips, your shoulders. Many times when people do these things on land, if they have other areas of pain or they've had a surgery, it can be very difficult to move your limb against gravity. But being able to do it in the water makes it easier. If you're walking forward or backward, you can change the rate that you're walking in. If you walk forward, you're activating your stomach muscles for your core. If you're walking backwards, you're activating your back muscles. So we're able to activate your core without putting any strain on your spine. If you get the water moving quickly, you almost have kind of that whirlpool effect. If you're walking quickly and you stop, the water keeps pushing you. You have to use your own balance and muscles to keep from falling over. So just simply walking in the water is a great benefit for multiple muscles and balance. Strength and resistance training. Some of the items that we have are flotation devices. When you push the flotation devices through the water, it creates resistance. You have to use a lot of strong muscles to push them down. It depends on the thickness of how much resistance is happening and the rate that you push them into the water in. Most of the exercises work in an opposite way when you're in the water than on land. So doing a combination of water and land exercises is the best for your overall strength. So besides walking, there are several types of things that you can do. Pushing the noodle underneath the water. It does work your arms, but if you don't have a strong core, you can't stay stable in pushing it down. You'll lose your balance and fall over. So you automatically activate your stomach muscles for stability. If you sit on a noodle, you have to use your core muscles in order to keep from falling off. That makes it very easy for the therapist to work those muscles. If you're sitting on a more vertical position, you're working more the sides of your core. If you were to sit on a noodle in that direction and try to raise an arm, you can immediately see that you're not balanced. As soon as you change something symmetrically, she has to work, look at those legs kicking. She has to work a lot harder to keep from falling over to the side because she changed something in her symmetry. With the dumbbells in your hands, you can change the position of your feet and just try to hold the balance still. Whether your feet are together, feet are apart, one foot in front of the other, you're changing the level of difficulty. If that's really easy, then you start moving your arms, trying to stay balanced while your arms are moving, trying to stay balanced without those floats. That's where you start to increase the challenge. Balance is one of the main things that people forget to work on. And then also pain relieving activities. So we have some examples where if somebody has back pain, they're able to go into deeper water with a noodle around their arms, and they're able to have their spine floating in the water. So if they're in a vertical position, up and down, with the noodle underneath their arms, they can just float straight up and down, breathing and relaxing. It's like traction for your spine without one of those machines that pulls it. And we've also seen some people where it really impacts their inflammation. You don't have as much joint inflammation when you're in the pool and you don't have high impact. So people that may benefit from the water, people who have generalized weakness, Parkinson's disease, people who've had a stroke, people who have arthritis or joint replacements, back pain, muscle injuries, if you have limited weight bearing. Also, if you've had fibromyalgia, many times any movement is painful with fibromyalgia, but moving in the pool or relaxing in the pool is less painful. If you have disc disease in your back, being able to do some of the deep water vertical floating can be helpful. It creates space for your discs. If you have MS, if you have had frequent falls, the pool can be a safer place to work on your balance and build the strength you need to decrease your risk of falls. If you have diabetes, exercise is very important in being able to keep your blood sugar levels normal. It's great to keep your blood pressure levels normal. People who have had a spinal cord injury. We have had people that have weakness in their body from a spinal cord injury, but when they're in the pool, because of the buoyancy, they're able to do some movement. Okay, so that's not an all-inclusive list, but I want you to think for a minute. Imagine being able to walk without pain, to be able to walk without a walker or a cane, or gain strength or endurance without feeling so taxed on your body. Imagine being able to regain function of your arm after an injury to the shoulder by way of support of the water. Or imagine healing faster after an orthopedic surgery or decreased swelling in your legs. Imagine your life improving because you can stay active. These are the things that are important for aquatic therapy.